Okay. Malwaise malungit litasil sen mora pekkel adar belam. Toko bet sa susul gidan ma ibdul mara klay mara bugul belam ma pilung be bir klay mara masil belam. Mara pekkel adar belam mara alsela blur belam ma ikler belam ela alsils. Irigan malungil litasil sen mora president ra senate. Irigan rugul senators speaker Anastasio marugul delegates. Irigan mugedre ela alsils sa mga tangata uk Omtira governors Maria Dr. Mais Roberts governor ng Ramnui governor vote madirigal Omtira speaker sa artila banggeda dirigal speaker ra malgayok madirigal speaker ang artno kumangay dirigal vice speaker Blue Warrior well dirigal kadamal mereka sula la faktor dirigal nira itay labang kita dirigal litasils dirigal mal mereka sula la media labang kita ngartiang mesang ngartiang tiabelaw kambes dirigal ngartia TMC awak dirigal ngartia Mr. Talams ra PWFM madirigal Bernadette Lay ra Island Times mal musulangan labang kita dirigal sils dirigal malungili tasil se morga vice president minister Matul minister Jenkins minister Obiang madirigal postmaster general Asanuma dirigal malungili tasil se minister health kumralo sa kalamlam mo meetel di tiya tamel kluangar aleda giredel durar adra blu جدر الألسيل سوا دريق المال التنات التريقال تقتنع البلاء وبنجد الغفرنور دكتور مايس ما دريق نيرا إيتي دكتور يانو دي دريق المناسبة إلى بلور أمريكال لو يوصل مثل دلويل رجيد وك تريال مدن التريل تقتنع البلو الميلدين رجيد دكتور بي دكتور بوستروم ما دكتور هانكوك أنغارتيان التملة رغسوس متو بنجد uk moniate level el small dagel current situation na balwad wasem el aldoral budulu eng wangarate telen e malungil litasil se speaker airai oi welcome bye. So first of all, good afternoon, Dr. Bostrom and Dr. Hancock. We are extremely grateful for the great partnership that the United States has with Palau. And especially when it comes to health, you have been at the forefront, not only providing vaccines, but providing the technical support and helping us in combating this extreme challenge that we've been all facing. So we are just grateful for the quick response by the CDC to be here so quickly. As you know, the cases in Palau began to spike, and just recently, and having you here, I think it is important for the people of Palau to continue our understanding of how to combat and to protect ourselves from this very contagious virus. Especially understanding the virus, understanding how to mitigate, understanding the best responses that we can do as a community, and most importantly, how we can all be responsible. Because as Minister Ghaffar and our team at HHS here in Palau, they can only do so much. And we have to thank them for their extremely hard work in keeping us safe. But they cannot do it alone. And it really depends on the leadership, and most importantly, each individual citizen of Palau. Especially those returning to come and visit us. So, as a role model, Dr. B and Dr. Hancock, you're wearing your mask. We're all wearing our mask in this room today because that's what we're going to announce today. The national government has taken the stand that we'll mandate masks in government buildings. But I think that there will be a health directive today to take further measures and encourage, not only encourage, but require mask in every building that's indoor. And the minister will brief us on more of those measures that we need to take to continue to keep our people safe and to better mitigate and manage this pandemic. So, akti mong telte alle mal di mereng asula blom regal metel to medal del wil rigid maule tirgal to gobet selok kyak sang rigid o malungili tasil se doctor senator Dr. Corte mal saun me join rigid la li tasil rigid mal mereng asula la blom regal sel to gobet sel del wil rigid ndegal di lo durok la vaccine manges wal mera hospital rigid mara adam temlay tirgal terul tiro من كده الجيل زي دكتور هانكوك ما دكتور بوستر ما ضوضن التريد تبرو المي سيل تال لابوريا وايجا جد لمصاد تمام تون غسيور جد راول داس ويو كواي سيجل رورو لقال بيبي رابلو المليا كرجيد ما يجيو بلابول سيس بريني مجد أسيا درو مسا ما هو تيال بالواد رابلو بيلاو كده مغراه سيل بعقل مغراه مرال بدولو اي رسيل غطرو التريتايل لو جيوا يجل لومسوب ما مرالو التريتايل لا أوريرت kita mal mereng asula la ati mergi drai osi ma minister mar adro hospital rogui ramri lu rerir diga dire kal moklorut sel me tirgara de doctoriano tu mel mosugid meski dai uk pesul da sora gel ukloru regal bebi rablu mal sumen di wile de por seguid e bai bok pastriate al mo bolong do e gulitra bodolida tigingir abolong do komal mesulang minister paskaula
Malungil talyal sils mansulang Mr. President, malungil talyal sils mara President ng Senate, marugul senators, Speaker of House, marugul delegates, mga ministers ng artiyang, direkal adra media, kuman masulang ang lirugul. At matingi Mr. President, tala siya baluwa mal klase pagkrengaringi, kada kuk mer elal sils, kuk stereo update o sisil time basta igol wagel blam dung kuno mestira te alla tirgal okya kargid nara CDC may mug polo ay sergid igel bukora ablal west regal bebira blu la tegid el togunit tegid el Omicron variant el gida omdas lo se seguid ya amdas oy sobra apelwadar belaum o sisil time kadulungit til may mitamo sa igel buk talang tingil aurelet lo me sa igel kukora sa paed el smisi ikut mok le kada mending lo setiam lami namo sa igel time gile del gimer lo sem lami makdo kuk mor sen next el mu sen next el bar lo sem magrada do malas men roba pridel el sela blu sa ba akter tirigel tira asabiin mal mosme ringi sa igel yamal mol mal objective ra ministry ra health and human services Egi daw tuira tirgal toktang rigi del ngar belaw o tirga gi del guk experts el ngara CDC may direct lo sisilta me waigal tilung ako da malas mal lomes el wase makaranga to rur tial operation ra covid response al mo wal bekal sils el teletele laurir ra hospital le waigal tilung ra teleklub siram na memong el alta me kamamro kuy al other hospital wagi dim albang artiang tirigel kuk omkarar sme yang ngara word at tang la diakal luldimuk regel urior elang rat tokora covid hindi direct tirga direct di adal wagi dim tamla sois bra adak talela tial rakta mong direct so adalo ngit tirgal sa lidal wasay elang artiang. You are here for 2 weeks if I'm not mistaken. 3 weeks, okay. 3 weeks, tengah tiada del Sunday, direct kal mongo sugi de segi de lomes lo se magra kuk tomes ra angru el trebsei. Kan meral melbui lo se magra apodong utmok at tele laurior. Make sure kuk other hospital sa biil masab akit dirigel tirangan yar sa dimlaraktir. May gel routine and services sa hospital. Kasi silta mga yar terung al dia kal tolor gid al direct kal mera kasus kuk Marcel Asper branch sa human health and human services sa Mitigation direct kal guk momes sa facility ra ospital may rogul kukta agel dospe elomgar dirigel mal mo hidol smera covid make sure agel rogul dospe angarngi ya urio tirigegi del mera kasusul direct titirgal terul ruba ka tigal terul toktang adodon teril Dr. Brostrom amlera last year angara onge del buil sera March ngi misel close team ra HHS mlen nga sergi del merus ra vaccine mora o mesin de sel time temle maklol adar nga niya rektir ma tirigegi del no underlying conditions among welcome back Dr. Brostrom. We thank you for joining us again. Masisil time Dr. Thane Hancock amlera August ni ma Dr. Cash ida mtingin sa August 20 inyam lo niya get lol el hotel gays el mesoy sa bebelaw sa igid August 20 mo da direct kal lo sa bedo lo ngit team temera August 23. So thank you Dr. Thane for coming back again to help us with this phase of this pandemic. President kadamdangel wasem kadamal ngat tangat lang namo erurakal dal selva ak umasin rablu-rablulat dimle talbuy la lopri de telrak rablulat etam lo soy sebra sel dingelel lo klo ko dal men mutelatan idang tangat talaga la selba ak la rurak e kol elang eng katigitel na mesal na mesoy sebo mangungil hindi kita madingil se tegidal dakt ay gal batokal buluam lamo tamlamos mauring Magsayagid ako ti imol kantil sel baak kat man makatir ta time. Lengwal dil at sel al Sunday. Yagir roguil. Lol sis niya igal bebi ra balu ra al sel irurak. Aba ata sis di al sel tal Sunday imol balu. Mang sayagid aring lalaurior direct kal sebokre nga tur sayagid. Makada kay nga sew. Tirigagit tirigal toktang men nga sergid. Tilmug talol ngit la sebon moklor ngut. Magigogit. Direct kal so dal wera da bestiria te ala di mestiria ada update ra kuk to cases makantak sa alsils. So dumingin na sa Eli ti lob da situation report dal lang niya dimle imol positive Eli manutra at 10 o'clock ra kasus dimle na positive case niyam le contact emlo positive. El alsils en el mutra eruclor el alita sils ang namon nga 6 el positive case 6 el positive case el tiram le contacts nara quarantine em lamo madang el positive elim lang niya imol suspected case malum probable case el atam lamo terum so dirga pending a further testing mongwal to date since August 2021 namlamo 46 cumulative cases el at time ang anya 32 active cases el ngara isolation facility nganya 14 namla recover da malupit na mo dakal bukuyun dakal namla release certi e malmol mga ni kaldel historical case condition at tirigal 32 active cases el al ngara isolation o masin tira dia ka symptoms certi ta asymptomatic tirigal da style nga niya symptoms tira di ka mild di ka kora bring la patingir man nga niya ongit kora makul o morokolin hindi ka katartir el mospe el mora gurul lamin mora mo nyuying malubang mospe akrul tel rakta tadi malatay lenol direct tara swadal kora smodi ra era da toyula te al mortir kal toktanga to ka adalu deng wan mel wase kama magi makra eko test so dal mutal makataklir sa el at time ang talgibal ng song sa test kits mendiakal sa el mga tmok ra community testing mga gel test dal dola per el anga mortir gel madang al wase ta close contact ya uriya malmon may sayid el contact tracing at suguma ada madang al wase close contact te sayid kita may test direct aradas tadir sa ilmora private clinic al sugum sorry mo test ngayel clinic nga ring testing ring hindi ko lingit tararad al wase al sugum ka il at time al sugum ko rasmer kerablim la ka mo mais mo ngoroy der kara adal smer gitong ila test kits el plada bus mamaran may sisit time ako na reach out tel mara bebira partners sa gid malamut tel bebira test kits. Sa gid ako kura dangaring ide at time ra to ko testing. Berak tikun mo di sa gid bay da pastiri at al tirgal toktang mal al kukul sa da gel le sa dal belo south maro ka real telik ter continue.
Sula Mr. lo mo ulan di sokal lo ay siro ase sel bleda announce ni lo ase kada mo todra kotulurio leadership meeting el moria bekla da me ra mayong adri ka man mon ra taklo ka kotulurio tiang di dere li le kada mara lo ase gira der mugudu mo lo ay sira da lo ase kada gira gel amra bedul gel mo so tido maktat ka bekla sulang.
Hello, thank you. Again, I'm Thane Hancock from the U.S. Centers for Disease Control and Prevention, and I want to thank Mr. President, Speaker, senators, legislatures, ministers, and members of the press, and most importantly, the folks of the people of Palau. That it really is an honor to be able to be here and work alongside you folks during this next chapter of the pandemic. For all of us that are able to come and work with Palau. You folks have been amazingly successful in responding and pivoting to the threats of this pandemic and working together. And this Omicron variant, as I mentioned, is a new challenge, and it's different from Delta variant, from Alpha variant. And there's two parts of Omicron or two parts of it. There's one part that is what is going to be the biggest threat for Palau, is that it is way more contagious than previous variants. It spreads very easily, and unfortunately, it is successful at spreading to people who have been vaccinated. And Palau's amazing vaccination efforts have been successful at keeping out Delta variant, but with Omicron, that level of protection is reduced. However, with vaccines, as we know, one component of the vaccine is trying to prevent transmission. The other part is trying to prevent severe illness and really reduce the chance that if you are infected, that you would need to go to the hospital and need additional care or die. And thankfully, it looks like that these vaccines.
So, Dr. Hancock, just for translation purposes, we'll try to keep it short so that.
Or Dr. Yano has to translate for me again. Okay, yeah, so the other component of vaccination, one is to prevent transmission. The other component is preventing severe illness. And with Omicron, it looks like our vaccines are standing up and still preventing that severe illness and reducing the chance that if you've been vaccinated and boosted, the chance that you develop severe illness after if you catch Omicron is still reduced by the vaccines.
Media, Dr. Hancock, ulsus rabeklat, ulu aisuk nasing marungul lobangget, hindi sira ongel buil mer elang, ngari nga baes el variant, igel wara tletele langkal coronavirus ilam kodoring mong Omicron. Ngkal Omicron na ngod malbuguyuyul. Emro mong direct limur ar adal na moringa vaccinated, tamla vaccinate, and then direct sabihin mo smer. Mong milogok mo vaccination, may kal vaccine ra dulay, ul kabay ra tiangkal delta, mandakal bukuy, mandakal yul, hindi akal wiser Omicron. Vaccine avangay, hindi direct dirga sa bedel mosmer, sa bedel lo liu retial ser mura at tamatang. Okay.
All right, thank you. So because of the contagiousness and how rapidly it spreads, we have seen in other places across the U.S., you know, and places in Europe, the number of even the best healthcare systems and public health systems to try to prevent transmission get overwhelmed with the number of infections. Just a lot of cases. We're seeing it in Guam right now. And so what that means for Palau is that Palau needs to really start to adapt and think about how you're going to meet this challenge of Omicron. And that's what we're here for. And one of the things that we've seen with this virus and all of the SARS-CoV-2, the COVID virus in general, is that the people that do the best in responding to this infection are people that the communities that can really work together. This virus tends to divide people and use that division to allow gaps where it can continue to spread. And so I think for Palau, with this new chapter, it's really going to require everyone in Palau to all play a part in helping address and respond to this.
تجد الأوميكرون variant المالبقويو يول أملا أمريك رابلورا يوروب مابلورا أمريكال دريك نات ماوت رابلورا قوام تم تجري مال ذو سبي را بلو المال موت ماق لسل سقوم بلي أبلو إن يوم برينغ لا ذا respond المرغي تيران أرتال لوبن كده الأورغنيسيو را ministry كده الأورغنيسيو مرال تلاتة لا بضاقي يومي.
So what everyone can do moving forward is, one, you know, the fact that Palau has relied so heavily on the vaccines really provided you a lot of success with the last variants, and also is going to help you protect you against Omicron. But if you're not vaccinated, if it's time for a boost, it's good to go ahead and get that vaccination boost now so that you have a lower chance of getting severe illness and winding up at the hospital.
متأكد الأوميكرون variant بلاو ملتقات لين بتوغر أذن لما يوبو بتوغر أذن بلام لما يوبو دي تأكد الأوميكرون variant الموت require مو سبيل دولايجل ترجل دملاغ لولا فاكسين أما يوبورتير مترجل نيلا درستبلون أما ما بوستر سيجد اللونغيذيرا أوروس أصاب كلي من ذا بولسير من يوين هوسبيتال.
The other thing that all of Palau can do is, when you think about those two components of the vaccine that we want to work, one is the contagiousness, one is reducing severity. The virus has snuck around and is more contagious. It can infect people who have been vaccinated. But one way you can help augment your protection against catching it, and potentially if you're infected and you don't know it, spreading it, is by wearing a mask. So by everyone wearing their mask, especially indoors, is actually kind of helps augment or improve that one part of the vaccine that the virus has tried to skirt around from. So if people in Palau, as this mask mandate goes out, really think about wearing this mask is actually in a way like a vaccine. It's helping you prevent from catching it and also spreading it. And it really is going to take everyone as a community to all really engage in wearing masks to help protect themselves and others in Palau.
متأكد الثلاثة للأوميكرون المالبقوي يول إن كذم لما يوبورجيد دي ترى رولل إذا ذول قبائر برجر تيال سير هذا سبع ماسك تيال ماسك مسوقاو كاول أذلو سبيرني ديرك المسويرن كال أذ من داخل لومير تيال سير ملقوك ملاسيسل الغارنيا رولل إبو بتوقل أذلو سبع ماسك تغونيس السوم ضمر السلابلاي اللي بقى تلورر بتقلا.
And then the last thing I want to emphasize today is, as far as what people can do, is know that this virus moves fast. It moves faster than our systems to try to contain it. And because of that, you might as well be on the alert now. And if you're feeling sick, it may be related to this Omicron variant. And so we need people to take action now to really be aware, try to get ahead of the virus. And if you're feeling ill, don't expose other people. Stay home. Don't go to work. Don't if your kid is sick with runny nose, don't send them to school. This is a time that when people are sick, you want to isolate them and really help reduce the chance that they are out spreading this virus. And it should start now, that people are really aware of their symptoms, and if they are feeling ill, avoiding exposing others.
متأكد الأوميكرون عمل مريض الأمريكا من بلوه الديمان ذالن إن أمريكا بلو رؤيرا وطورا وجرول قبل الأمول التمرني من غلقيت ناسني ذي هذا المسمير الراتريت المالوبين سمير بلو لوسيقال دولل اللولنيت ملاقل لو مايس مالوبين تو ذا الموراباي السبيل لو ميرغت تيال سير الموراباي بيرا هذا بالكيرا بلاي الدينيل تان وقرا سيلف كوارنتينا تتل.
And so what we'll be doing while we're here is, as mentioned, we'll be working with Palau to really try to adapt and enhance the systems that are in place to meet the new challenges of Omicron. So that'll include looking at some of the containment strategies, the contact tracing, isolation, and quarantine, as well as looking at the clinical preparedness for Omicron, because things are slightly different and want to adapt those systems to meet that new challenge. So certainly this is a time where I think the community can really work together, try to focus on that unity, but be aware too that it's going to require some changes in adapting as you guys move to meet this challenge. And so be aware that, listen for updates from MHHS on new guidance and those sort of things. But I think there's going to be a lot of opportunity for Palau to enhance and adapt the responses as we move through this. So again, just as we go through this, want to encourage, one, everyone working together, recognizing that we're all in this. Everyone has a part to play in helping to reduce the impact of this Omicron variant here in Palau.
ملغوي تملي الملاس المسؤول Ministry كده Health مع Human Services الجوك قميص يقول تلاتة الجري الموضوع التراك راتت اللي لنقال بأس الفاريانت راتغير برجيل را public health دين direct التمول مسؤول أذرا أو جرول الهوسبيتال جيد منغرال تلاتة لسبيل مو وقوقو أيس مو ألسيس عقل ترجال أذادرا هوسبيتال من مو سبيل المس امرقون respond مرتيال بأس التلاتة الدنغارني مسوري الموضوع لبنتريال أذرا health را clinical مر أذرا public health.
All right, well, thanks. And my colleague, Dr. Brostrom, is much more eloquent than I am. Sorry you had to hear the spiel from me, but he said he'll wait for questions and you'll get to chat with him.
Okay. Are you sure about Strom? Dr. Thane aknasing ba ulgyong lobalam sa leader Dr. Bostrom and pong biria by ngaring ager ngara media bol sebel longer.
I guess ako dala mamoragir maroko sel budo merege budo ay sagil talang tingin lagel mandates and mo take effect rel alsils.
questions, but thank you. We're glad you're here so we can have this opportunity to pose the questions. The Omicron, we can see that it's spreading quickly here in Palau as it is in Guam. There's been comments or requests coming from the community that it's probably better to close down the border and clear it up before we reopen. Do you think that would be a good solution to this, or should we just, learn to live with it as it is?
Thank you. Thank you for that question. And so the question is about whether this is the time to maybe shut the borders down completely, because there's Omicron in Guam, there's Omicron in Hawaii, and the risk of bringing Omicron in is higher than right now. Your policies that you have are strong, some of the strongest in the world, but Omicron is very tricky. And so that's obviously a very local decision. Palau has made great decisions with the ministry and the executive branch and the physicians, the esteemed physicians who are here, made great decisions for Palau, sometimes against recommendations even, and very strong, and you've benefited from that. However, I think with Omicron, it's so infectious that the type of closure of borders would have to be very, very extreme. And most importantly, that horse already left the barn, as they say, right? So I think you have Omicron here, and closing the borders may not bring you much advantage at this point because Omicron is here. It's amazing to us that it's already January 2022 and you're having your first cases. We would have thought this would have happened long ago. We thought it might happen with Delta, but it didn't because of your strong policies and your community support. But I think for Omicron, as Dr. Hancock mentioned, it is just very different. And if, again, a very local decision about closing borders, I don't think it will help you very much at this point. I think Omicron's here.
Okay. So you keep mentioning about Omicron. So has there been tests made that we have detected Omicron in Palau?
Thank you for the question, Bernadette. So as you know, we do not have the capability on island to do sequencing for samples. We have prepared 16 samples from the first cases since December 27, which we'll be sending out on the Sunday night flight to Hawaii for sequencing. But I think the doctors will agree that just based on the characteristics that we're seeing with these cases, we can safely assume that it's Omicron variant.
Did you have something that you... I'll ask my question after you.
Okay, sorry, yeah, and I was just going to add, as Gafar had mentioned, that right now the number of cases in the U.S. Of COVID-19 that are caused by the Omicron variant are at 98%. So, it's the dominant virus outside in Hawaii, in Guam. So your cases are matching the surge with Omicron. So we'll wait for that sequencing, but I think, again, it looks like this is Omicron, and it's best to respond as if it is Omicron.
So my question is, with the horse already left the barn, is there like a predictive model that can tell us, like by next week or by the end of the month, the trajectory of the spread?
Thanks for the question. And so there are models that could tell you what to expect, models that are based on what happened in South Africa, models that are based on what's happening right now in New York or in California. But most of those places have already had several waves of COVID-19, and you have not because of your excellent work here in Palau. Most of those places, all of them, have less vaccination than you. You're one of the best vaccinated countries in the world, and this is when all that hard work is going to pay off. They'll really protect a lot of the elderly people. So we're watching what's happening in Guam, because that's a highly vaccinated population, also with lots of comorbidities like diabetes and obesity, for which we know Omicron is also dangerous for. Those folks especially need to get their boosters as soon as they can if they have not gotten them in the last 5 months. So the information that we have is pretty limited to what to expect. What should the hospital expect? And then what should the community expect? So we don't really have good enough numbers to share, but we are working on that. We have a modeler at FEMA who's already also trying to help crunch the numbers. But again, Palau is a very special place, and whatever models that Omicron has demonstrated in other countries will probably be different here. That's one of the reasons we're here, is to help the ministry be able to anticipate what might be coming next.
Mr. President, ngora suado rong sao e rong sia ministera health lo aisak mo kia da ngara phase 2 malu da ngara phase 1 tial i COVID-19 suado mom dang li segi da dur ulela li receiver belau il girel tial COVID-19 elala time.
Ano sulang Mr. Talams. Kung dasel al time, aware po ko sa phase 2 kung dasel close to telela po tingilo sa self plan bla totobdi sa paedal mo dai sa edal mo dai ang idik time mo atera situation un tirgal terul toktanga ubungit mong sa edal wase oy al time lamo gilid al more phase 2 dem lamo ringia oy wadela rak tara adal dimlak al umrail al muratara adal dimlak al umrail so akmadangelo sa gan umre kal telat club se kadamal qura idar sel bulgula community transmission versus a travel related case. Obviously ngiro kul di mo travel related case and di al time tuy regal blal dutti regal tokta megel do dengi ityang mo approve mong atidil qura cause of panic hindi sa igi dia reality the facing. So al time ang wal gida more phase 2 mong ngariegel tablong malubong kaldel tablol manday tama imol malqura klolongit el mara adra blul bodo dura el alsils el nia omur sa gidil tetelela riol gida del motmok ngir rogui el gida tiang so muta makataklina mo gida del mara phase 2 el alsils mong wala bodo mereka mo announce sa gil manday tam sa gidil klolongit telwase at sugum kasmer el time mukta kang da kamumaysa kira blim igi tongi lagi gida testing. So seguido dengan ngidel atan. Ngay sa LLC sa gimo revise directive el mo mandate ta mask ra rogul indoor spaces. Mo mandate ta mask ra rogul indoor spaces. May gelon di ra yik el gatherings el ngara lui el adal morbo. So we're gonna mandate mask indoors. Except trablidi are out of course so marugul restaurant marugul siobay marugul office maskul agida talo maskara alsel gel gora maklolon dipel ngara outside mol timuk rarwa kamaldil umangat agida talo maskara ngari o sisil time selong irung akan mo practice physical distancing so kadal mo tel more sel la dablaringil teletara lokot talo mo tel pandemic and make sure I get roguil kingal ma pasyol mornya undi berarata the space out ra ay gigil ngaring hindi sa lomes sa gigil phase 2 eng sa edel malmon may get rogul dorura bekkel sils sa gita direct gigil mo kataklilo sa el time makadira ko tour sa gigil was in dia ka close sa school at sugum mornya guys rawan class e ko focus sa gigil mong ngora talgi bil amo obrao del mora radalo ring septiang di segi dia plan ergi yakuduk komes ring yal sugo munguk man mo hido el wangrang yakuduk more sel next daw sel next step bakmuta mo katakli oy kadangara phase 2 elang egel got talgi bodol ngit ring yal adara bulu akmo Thomas kregel bekel indoor basyo meruko mayik langsung kadangara baklol koro ondib malurong activity including one night market tamba egel blaktung was is it time kada mo practice ra physical distancing egel mo telo o ngitra adalo se pom nga orus el alsil sang open up path namonia orus ra pediatrics el 5 to 11 year olds el start ra Monday direct kal mlame Pfizer matirigel baklol adal sa edel mo malab a booster gi so orus adir kamaran may sa polguk nasong sa kuluguk mo tal malay sa gida ko ro ngita lato.
My question is to Dr. Bostrom or Dr. Hancock. How's the Omicron variant compared to the other variants? Do you see, is it stronger, is it weaker, is it, what's your outlook on when you look at Palau? Because I know in some other states in the U.S. things aren't going as well, but some states are. Are we doing enough to be sure we're on the right trajectory or not?
Yeah, I think, and I'll let Dr. Brosham say a bit as well, because I think if we both explain it different ways. But we're finding that the Omicron variant is much more contagious. It spreads much easier. But it does look like it's causing less severe disease. So of the cases of people that get Omicron, the percentage of them that require going to the hospital or even having severe illness and dying is much lower than the other variants. So some of it's good that severity is less, but unfortunately it can spread so easily that it infects more people. So even it's a smaller proportion, in some places that's representing a lot of people that are going to the hospital. And so that's why we really are emphasizing one thing you can do to reduce that severity and really help protect the hospital is by getting boosted, especially for your most vulnerable people. So people that are older, people that have diabetes or are overweight, they really should get boosted if they're not. So that helps reduce that severity. And then the other thing is for the contagiousness, as we said, some of these community mitigations that you can do by wearing masks, being very careful. If everyone in Palau can be careful about situations that they recognize are unsafe. If you're indoors with a lot of people with the mask off, that's a dangerous setting, right? And if you're outdoors with a lot of people and it's really crowded, and that's another time that you would want to wear a mask, because this virus likes to spread, from our mouth, from our nose, across to each other. And so those are two things that you can do to help really mitigate the new changes that Omicron variant has compared to the other variants. So one of the other things, now we're constantly learning about this new variant, right? And so some of the things that we may say now, they'll change because there's a lot of new information coming out. But there is some early evidence that's showing that this new variant tends to be in the saliva more than some of the other variants. And so certainly in Palau and across the Pacific where people chew and spit, that's another thing that you'd need to be aware of, is that saliva, that spit, could be carrying the virus. And so be very careful about your chewing habits as well at this time.
Thanks, Dr. Hancock, and thanks for that question as well. So as Dr. Hancock mentioned, the early information we're getting from other countries, it does look like Omicron is milder than Delta. Still a serious illness, but it's milder than Delta. And we can look to see what Omicron is doing to the hospitals, and can go just to our neighbor in Guam and look to see where there are hundreds and hundreds of new cases every day of Omicron. And people with Omicron are in the hospital, but the rise in cases in the hospital has not been nearly as high as everyone was afraid was going to happen. That being said, it's still early, and it can take several weeks sometimes before people who get mild disease will end up in the hospital. But so far, it looks like it is still serious, but it is milder. And that's part of the reason why the rest of our team, who unfortunately is not here right now, is because they're going to be working at the hospital, looking at the oxygen systems, the ability of the hospital to handle several patients at once. They're also going to be looking at your medication stocks to make sure you have a safe level of the medications that you'll need to treat patients that may come in with Omicron.
Minister Erbelauer, I mentioned earlier nasing Gasaya testing kits. Total other soril mamlater test the available material frontliners, material public health employees. Nanya it's rather salit tungo sa igidal to access ang testing.
Say malungin ker ngoy say ngaringa may dalawat tela la teskit sa maran may gigid el blad order gigid amla move del longit trar salid el may dergid el was el sabel lo duro club togra bida mred tan ndakal segel mur el allo sing maloy ngarang hindi salgibo mo tingi se agi mo announce maselbol ta announce ko mo OI sa sing morgera testing mo nga tele
Minister or any of the doctors can answer. So what does this mean for the younger kids, if you haven't answered that yet? What does it mean for the younger kids who are unvaccinated and physical distancing might not be possible, like in schools? So, yeah, what does this mean for them?
Yeah, that's a tough question. For the kids, unfortunately, we're finding that Omicron, unlike the other variants, can infect kids fairly readily or easily, and they can spread it as well. The good news is just like the other variants, it looks like kids, it's very rare that they get severe disease, and so that's beneficial as well. But because of that, I think there is going to be efforts looking at how to ensure that kids are going to school in ways that allow them to reap the benefits, important benefits of schooling and face-to-face learning, but in the safest way possible. But yeah, it's we still would recommend that kids, if they're eligible, that they go ahead and get vaccinated. There are still some cases, rarely of severe disease, and that vaccination helps that. And the vaccines do help with the reduced transmissibility a bit, just not as well as they used to with the other variants.
Just to add that, I know that the program here has also been able to make sure that the children with special needs are also getting their vaccines, because many of them are more susceptible as well to the virus. But as Dr. Hancock mentioned, it seems to be mild. When we look, in general, this is with the Delta virus, but when we look to your neighbor in Saipan, they've had about 4,000 cases since their outbreak began in October. And there's one patient, one pediatric patient that was in the hospital and has since been discharged. So that's pretty reassuring that this disease typically is pretty mild for kids. But they should be getting their vaccine if they're eligible.
With the tiagidel COVID na spike Aurora Public Health del Svelo Tugurtial el spike al sela igal melfiu iksal sumangantinul el eda positive cases al sela igal melfiu iks.
Isi sulang ra agir mo ongere o sisil time mo oidi Ulingit tra tirgal terut tokta. Sabuk tetele legal belum wekker gidel seral sisaperte gidel. La moringa gays la overwhelm ra other public health. So al time ar atamam ang ringil ul dageta kay gal contacts. Kami ang matingil kom lamis ra si trip. Dim le imol gays tablol gays. Emlo nga radar tamadangil contact. Igitelo mes ra si gal contact ta umesin dringi. Tirga ka bol positive, baby ringan na mo positive. Ding la sa edal assume lo sing. Kel baby la mo positive. So mal hindi ka role lagi mo to tagi. Mauul misal number 1 messaging lang was tugtakang sugo makadasme ela kadomay sa dong roy dirigi dira adasme. Morning time ang mo ka enough room ra isolation facility. Matukuk mo imul mo ra isolate ra complete. Sige da kuk next gira dalo mesringi. Sige da reality. Wagel tilong hindi ka kateme dal adjust. Matingin la sir ada dir ko madak talo sa ngara mga niya positive merero ra blue. Ding sige da reality. Unfortunately sa LD next week ikaday moon more sige. Al suko mundi malmol nga niya guys hindi manan mo. Kotuluria lagi aku motabadi atara ako ra usisak kalwase sel the force lagi del face and namo gira del digi del isolate travel del sumo del positive ngara mangara nga gira del maroon mangara nga dekal gira del maroon sige da next face hindi el at time at mama amal maringil dagi ta kay gal guys ladi asira telat klubsay emla mo dekal sa amal lotiri dik uger tegi delo sisilgel mora Dr. Tain ma Dr. B malkuk kul share agel experience ra pelura kwam masaiba le sera bol sisa per tegi del face. So Dr. Tain, the question is, how is public health's capacity right now with the activities and whether we think we can sustain it given what's the situation at the moment?
Yeah, I've been really impressed with the work that public health has done so far in identifying cases and quarantining contacts and that work. But as you guys know, that work is a lot. And everywhere else, when this virus starts to spread, it rapidly outstrips the capacity of public health to do all that work. And so that's where more and more, and you'll see across the U.S., we are relying on the people of the community to really also play their role and help with isolation and quarantine. And if you're exposed, being aware that you may have been exposed, and if you start having runny nose and stuff, don't go to that big family dinner or those sort of things. You want to stay home. So I know that public health right now is doing all that they can, but everywhere this virus has hit, it overwhelms those systems, and then we have to shift. It's a normal pattern. It's not a failure. It's just as you adapt to the different phases of the outbreak, there's a time where you shift away from that really intense isolation and quarantine contact tracing to a more community-wide mitigation.
Yeah, well, maybe there's no need to add, but we do see some real heroes for Palau, people that have been working very hard with quarantine and isolation. Many thousands of people brought in safely, and they're tired. But when Omicron comes, it so quickly, as Dr. Hancock said, it just outstrips your ability to continue this level of effort. The staff needed, the hours needed, the hotel rooms that are needed, quickly just grows with Omicron to a point where you just cannot sustain it. And that, as Dr. Hancock very carefully said, that's not failure. That's just the next chapter. It's a normal progression of this pandemic, and it has happened everywhere where COVID-19 has affected the community.
And while that isolation and quarantine is an important part of the response, it's just one component, right? And that's where I think really all of Palau can really engage in this response by, one, getting boosted to protect yourself from that severe illness, and then wearing a mask so that you're slowing transmission down as well. So I think those are going to be really important moving forward for all of Palau.
Hindi follow up per se gitu ngari me Mr. Talams. Hindi akal bergulak mo gisto belodio. Hindi sa kita yoling itra coloring ra atra belum. Already agi mla mamal betokon ngaroy lama asius. Yoling itra sa dito bulklor mo.
Minister, jadi ko di related al morti lang. Ngani Maybe our parents will direct them mo tadi concern the cell wasing tadi ngila instructions ko kasi mga lagi pum na diyan sa el wasem isolated hindi ako na follow out mortir kasi sabihin mo rin yang kanya maybe na obvious na close lang lagi na smear man diyan sabihin mo rin tira ko logel kasi ngara instructions sa mga kasi kam sa mo rin ang ngadang ikikita ka question sa balloon mail.
Man sulang yang waklet lagi dia kundas singgiram mo omesengi al-alsil sil direct. Mo wasing malwang rang at tele at sukum ko close contact. Al time yang wal true el klubse al sukum ko close contact. Ma Minister Education na direct kal mo simbay lo se el at time el ngara dart el student ma asense ang ngara quarantine el to close contact din dirga kabol positive yung wal true el klubse dia ka school dia kal ngara school ma direct kal mlabop to ka ding one mail masada igagidil lo se other employers na mo require a negative test result in order to let their workers come back. Nung ulingit ta sebas kama may alsil sa over the weekend, bodo bakat taklil waseng malwang rang at sugum kamle close contact ng telat club sale girem di ngarablim maluubong sa emel morior maluubong diak. Di bas kama matay mal bakat takli sa igit, will say it'll move forward.
Okay, so we had reports of 2 years old a baby who had a positive case. So what are the precautions for the newborns and babies who are they required to be wearing masks or like, and they have a regular appointment with the hospital, so how do we deal with those?
Yeah, so the recommendations for a mask are for 2 years and over, not for newborns. And so because of that, people do worry, well, what's protecting the newborns? And one thing that we're really encouraging is that mothers get vaccinated. So when moms are vaccinated, especially even while they're pregnant, if they're vaccinated and boosted, they can pass those antibodies that help that baby, protect that baby against COVID-19 onto that baby. And it looks like, in fact, the antibodies from vaccines from a boost it looks like they do come out in breast milk. And so if the mom is doing, and again, we always encourage breastfeeding as something that is so healthy, it can even help the children as well, help protect them. So we want to encourage moms to go ahead, if they haven't been, get boosted. And of course, breastfeed your children, your infants, and that can help protect them as well. And then lastly is really, we talk about, there's a term called cocooning, where you're creating, trying to keep a safe environment around that child or vulnerable person. And again, wearing masks, being careful about, where you might go and what you might do to expose yourself if you have a child in the home. Is important. But then lastly, want to reiterate, we're one of the fortunate things is that the amount of severe disease that occurs in infants or 2 years old is extremely rare. And so that's good. While they can get catch this virus, the chance of them having severe disease is quite low.
Minister, one of the fueling misinformation or fueling anxiety and fear in the public is the misinformation. So how important is it that there's a timely communication and timely information from the public health and from the government? And if you have any suggestion of how people can be well informed and not wait for information a day or two during this time.
Thank you, Bernadette. Obviously, it's very important to be, for us to be first and to be timely and to be credible. That's something that we really need to work on now, especially with these mandates, and then moving forward, those re-emphasizing the preventive measures. But really, Bernadette, they're all in the directives that we've sent out. I think people just need reiteration to encourage them. So we will do that. We'll start making sure we have more messaging out there. One thing that I do want to mention, and this is something that's I mentioned earlier, is sometimes we get caught up with the technicalities of definitions and things like that, that we miss the point, which is please practice the preventive measures. I know when we're anxious, we look for more answers that are already there. But yes, the importance of timely and credible messaging is important. So we'll make sure to improve on that. I think we have to understand, even with the EOC, we're dealing with this just like the public. So sometimes it's a little slow to react, but we'll definitely work on that to improve.
Minister Werbalawa, sa domestigal recent positive cases and the travel related. Querel mande como implementa el protocolo no testra tegerogul passengers arrivals airport. Usisul time que der gumla mention tergal health workers health already overwhelmed. Umomisa tel continued flight telming manageable around their public health ergida system real time.
Malungil ge. At timing the maring dala testing ra contact sa mga outbound, mga day 4. Hindi so far ako na manage. Sa higit del plan na mligid del kora omes ringil was sa the reinstate tala day 1. President tamla announce sa ko na mo reinstate tala day 1 test. Magi mo gut mutli. Di selguk suguma gera kora maral bedula sen sa edel kukko mes regals kogi as again the decision leadership hindi sa higit ako kora omes ringil atan.
Sula Minister Werbalawa, ngari ako ratele menam ngadadura leadership gera la possibility musto baskogi especially tial United Airlines led tanganyara do sebaganan rir mutegi the spike asabel mo ula cabinet Taiwan amo consider sel travel bubble lamang mo sabel mo affected tel medical referral gidar other belang.
Sulang Mr. Talam sulogar tira alger eli gloria tele del el mitra ambassador a Taiwan. Of course it concern di waigid trigadrigal manangari wa case tira covid and then dirigal ngari community transmission tir real time mamle tingil ambassador abay mlara point wase gimgra help prevela already ngari on tidel mortil wase yo spera teskit yo spera af el menase orgit entonces sea importante el message ma tigal partner sa solo el menase orgit dirigal ulo ay sana galo wase sel Chinese New Year holiday el maral may rek med le del after tourist el sorin merbelam already mla tamla bugat tiget tir mun as of this time ndriga plan cancel el flight يجي دامدين عشان مالشوا ذا الفلايت الميلين والتقرر اسمه المراغرو له والتقرر تيلمي tida do dongali tamla reduce ra di sira patient la accept tira el hospital Taiwan ngrawul tediri kalau mesa uka increase ra cases tir mete limit ra adal accept tir sede gal gida ul na increase ra cases ra blura Taiwan mong ngoise kita malbodo baigar rogul toy o mesa ra se ngarai gel se adal mrul ela gadiri kalau mesa ra se ela labulat sira patient en ma Taiwan ngedro sender til uko ya kwam en mora Manila se other option mong kada malbodo be o mesa I think we dia diri kalau mesa ra positive side el alsils I think a minister na makatakli tige rogul cases ada katertil ngar hospital may say disease masa dosa toba armel ding meet ut ngi derang area symptoms sertir malu bendia di ayamral mobtok se lo sadri tikat toktang o se ngari atte lel morsel time la ngari adan mo hospital already tiarrakt already mla sois beral se la blur belang moigel lugo Dr. Bostrom a limit tra flight a galel lagal seya a solution abay solution ang arale dar bek other belaw low mask practice ayel will practice ayel distance malmol malsum das mere di tangar ablida yida del guru letay abesel التلاتال نهار alsel mong kada malmol mlomes of course ngari se clone meeting ra leadership ra ablul berara Monday of course I'm invited al Marcel meeting modal mutro agera el mutel masao disel important el gumrani haset tigar ruba ngartel help pergidringi ase melal doral bedulu ay mgra doru ringil sel gotrungil tretal el gadomes aygal ukngari capability hospitaliyid aygal bla doru rangara mol may maybe ngari gel gida namo masamo kul mo atter ti al rakt gida para el altan gida do mol molomes do mol masamo kul mo sulang ragir.
I have a couple of questions, and these were questions coming from the community. For this Omicron, if a person acquires it and then gets better afterward and recover from it, can they get infected again, or will they have natural antibodies that will keep them well after that? Or if they have other strains before?
Again, there's, thank you for the question. When there's evolving information that's coming forward, we already know that Omicron has a special ability to reinfect people who have already had COVID before, different kinds of COVID before. We don't have any information yet whether if you have Omicron once, can you get it again during the same outbreak? Probably not likely, probably just once. But if you've, and we also know if you've been vaccinated, then you can still get the Omicron. It's almost always mild. So I hope that answers your question, yeah.
Okay. And other questions, there's questions coming from the community. The case in Saipan, the first case, the reported case of MISC, you mentioned that it's very rare for that to happen in infants, but people are reading, so they're kind of worried that, what are the chances of that coming in?
Yeah, so MISC is a multi-system inflammatory syndrome that can occur in children that we've seen that it can occur after getting COVID-19. It is rare. It doesn't happen very often, but it can happen. And so, I think as parents in Palau, thinking about, even though it's rare, if your child is eligible and can get vaccinated, that helps take that rare chance and make it even more or less likely to happen. And so, again, I think, if you have a child that is eligible for vaccination, it's a good opportunity to get them immunized.
Okay, just one last question, and I think you've already answered it, but the people want to hear it from you. So in families, you have families where you have elderlies as well as children. And the question is, what you recommend is a way to, ensure that the kids don't go out there and bring it and infect the elderly. So that's a question I think, they want to hear from you.
Well, we do know, like all the other versions of COVID, that the spread in the family is a major source for sharing COVID. And there's information forms from CDC and from other governments that have talked about ways to protect people in the house if there's been a case of COVID in the house, what to do to make sure there's not too much mixing, to spend time together outdoors, more outdoors. It's really important to, if a family wants to be together, that they try to do this outdoors if there's COVID in the house. And so there's good instructions that we're going to be working on over this week, next week, to get the community ready for how to manage quarantine for patients in the house. And so you should look forward to more information coming from the Ministry of Health. In fact, we saw a draft version of that this morning already.
Maldi one last question ako gusto rin. I know you mentioned in the beginning that you're here to help the Ministry of Health with the plan moving forward and how to deal with the possible cases and increase as well as other services that are being affected because of the increase in cases. And so that's probably going to come out later. But right now, Minister, if people are sick now and they need a service, but they're afraid to come to the hospital because of this fear of COVID, what do you recommend to them, or what should they do? What's the protocol, or do they just stay home and wait until it's serious enough to call? I mean,
Yeah,
that's kind of.
I understand the question fully, and I know that now people are probably wondering I guess di mild lakong panic hindi kalswada ko tokol atal mail di memelatay lenon for now o sisilta lagi ramal mo mesra ko ra separate clinic alwa duluring ira H1N1 tirger roku ilgorangan ya flu-like symptoms sa morgi instead ra mo raigal more OPD malum jaksal sure ako private clinic ilwasing mongarang ako maudru ulit tiang hindi sige dagi ko pamaudru ra Kroll Hospital el malas memru sige di el gora separate el clinic el giri ra adal ngania flu-like symptoms erti hindi sige di sugumong el at time el gora mangan la mo klase bakreng sugum ko kora di mild symptoms ergaw la mo emergency care malum urgent care ito las mga sa talabiset.
Minister, a couple of months ago, قبل ما انت تبدي بيد المومغت موكرا contact tracing makora seseng el algoritmo laber katiang seng asal apply ngil mera community al ubang di ngara border maseleme kita mesti rai kay kiti seng ngawrio lang
sulang ramalungil kere ungirung di axel system dirga ka da launching sel group na issue ra PNCC ra group tara tokoy tara bit amlo affect sa igi wal dulngi sa igi el group tara real makatmok raw erabol sa mamal makatmok per se adi sa kal pung lang sa igi del sistema tolmol man mamalaring leng direct sa pedro speringi ra tokor watengi fever ma pagaraw sa bugo yurak tal ko speringi ra igi el features sa niya bodo speringi ra pagaraw sa even mailangan sumo kada mo sa edan ngura mari at time sa edan uspe ring gila la COVID-19. Hindi haladi ko kaya tirakan lo sa way sa igid el system ang ladir ko sa al regal baby rablu. So the question, Dr. B and Dr. Tain, we were planning to start that contact tracing system using SIM card based technology. So the question is relevant or even feasible to continue to plan on getting that up and running? I did answer that it was our plan to also utilize it for other means, for other applications such as dengue fever tracking. But in other places, is that something that's still feasible to be used for COVID, given the Omicron variant and how it spread?
Yeah, I think it still would be something worthwhile for you guys to explore, even if it's, let's say, too late for Omicron and you guys have moved past Omicron, but we're not sure what this virus is going to throw at us next, right? And so I think building those capacities, continuing to build those capacities that are appropriate for Palau is important. They, some of the technologies that have been developed that look like they were going to be really beneficial have maybe not been utilized as well as they can, but doesn't mean that this one may not be appropriate. And especially, as I mentioned, it's good to have that capability for, as you mentioned, for other things or whatever COVID throws at us next. So are other places still using it? I think there are some places in Asia that are still using it. In the US, there was some effort to do some exposure tracking using Bluetooth. Guam implemented one, but they are not using it quite as much as they had hoped to. And part of that's because a lot of these technologies require uniform adoption across the whole community, and if only a small portion of the community is using it, it's not as effective. And so there are some challenges there. But yeah, Hawaii's got one.
Yes.
Sorry. Tel kera yakora may yakora kamil terul private doctors ngaral ang mga services regal clinics kami wa Elangos. I'm sure there's a lot of people that would probably be coming to you or needing services beside the Ministry of Health.
Yeah, the services are the same. We treat everybody the same. You come in, you get screened, and if you're suspicious or been in contact, then we refer to the right people. So, we're not going to turn anybody down.
Sulang ragir. Asmel al screening iram dalatwang. Al sugum uspe a test and dingarat ay krela klinik at may test ringi. Al sugum negative and move. Al sugum mo positive ag yodruk lil mara public health.
Question for Ministry of Education, perhaps health. I'm more of interested about students' school closure. What's the benchmark, or at what level do we begin to look at this closure so we can prepare our students for distance learning and what have you? Because some of the elementary school are holding their kids. Facts are our sixth grader, we held him at the house for a couple of days, but he has to go back. We have no reason why we should. And we don't, it's still unknown, so can you shed some light on that?
Well, as a result of our meeting this morning, the school also has a COVID mitigation plan. that works in conjunction with the national plan. We are also moving into phase 2, which has the required masking, but goes into much more detail of things which we're going to be working on. Those will include, of course, the hand washing stations will continue operation. We'll upgrade our disinfectant use in the schools. We're also looking at the spacing of our classrooms in terms of interior, where they're still losing masks, but we're looking for keeping at least a distance of 3 feet between the students, having the desk face pretty much in the same direction, and then increasing the ventilation of the rooms with use of fans. And in the case of those rooms which are air conditioned, and trying not to use the air conditioning, but instead using air coming in from the outside and using fans to exhaust it out. Those are some of the things. Also, as we go through this, we're looking at the outside activities of the students, where we will have lunches. Lunch will be, in the cases of the larger schools, we'll probably be staggering the lunch periods and keeping the smaller numbers of students going into any cafeteria at one time. And again, the distancing, would that be? The essence of moving into closing the schools would require a significant change in the number of people who are infected, and would relate greatly with the services still available at the hospital for that. So right now, there's no firm number, other than if in case the services of the hospital appear to be overtaxed, then we are recommending closing of schools, but we're not even close to that yet.
You didn't mention the transportation. You
but-
talk about the classroom distancing,
Yeah.
but about the like school buzzing.
Okay.
Do we recommend that we take our own kids to school, or you do the distancing in the bus as well?
Yeah. We're also recommend masking while coming to school. On the buses, it is also required. And we're going to be working with the bus schedules to try and find out whether we can maximize the spacing of the students in the buses. But again, parents, if you wish to bring your children to school, are always welcome to do so. And the drop-off points will be different, because the buses tend to arrive at a different time than the parents. Buses usually get in quite a bit earlier than the parents for the hot lunch or the hot breakfast program, which will also be looked at in terms of numbers of students.
I'm hoping I can just add briefly to that. And that's a great question. And what to do with schools has been a problem for every community facing COVID-19, especially now with Omicron. The first thing I want to say is, whatever changes you make, the one thing about Omicron is it usually comes hard and fast and then goes away. So the information that we have would make us guess that this would be a 6-week or 8-week event, of which you're just starting now in Palau. So whatever changes you have to make are temporary. And that's really important to make when you communicate this to the people who live here. Then also for schools, I think most folks at this point are finding it's better to keep the school open if you can. But some of that, as we talked about earlier, really means that the parents are going to be willing to keep their kids home when they're sick. Sometimes we wait for our children to have a fever, to be really quite sick, before we would actually hold them back from school. But now things need to change right away. And so if a child has a runny nose, scratchy throat, this is the time then you should be very conservative and try to keep the children home and not send them to class. That way you can keep your schools open for everyone else.
Okay. Ngora lama mlangarak kre waklok. Magdaseng amla mo mereka gira media for now. Gidan mo tumo meeting ra Monday. Mle soda alboniate lela ministerial direct muigel mo special changes. Yes, much other mention Senator Quarte, Dr. Quarte.
May Presidente di Critel, question ng gamal, nakarirak mo din sa almum So everything I've heard and everything I've read is that this is a mild. Omicron is very mild. We're not testing for flu. So why are we testing for the Omicron? What's the purpose of testing?
Thank you, Dr. Corte. And while the severity of Omicron is less, and we're somewhat optimistic about that, it unfortunately is still more severe, way more severe than our seasonal flu. And so that's one of the reasons why the focus on Omicron. But you bring up an important point, is that while the healthcare systems and public health pivot to this new threat, there's a lot of health conditions that exist in the community that can't be forgotten. And we've seen in some places where people only respond to COVID, and they're too scared to go to the hospital. They neglect their diabetes. They neglect other things. And so I think ensuring that people are aware that other health conditions can occur during COVID, and it's important to not only for the Ministry of Health is trying to keep things open, but also as patients themselves to make sure that they're keeping up with their medications, taking meds and those sort of things. The other thing is, in regards specifically to the testing, there are some test kits in the hospital that you folks are, I'm sure, aware of, like the BioFire and those, which is a machine that does a respiratory panel that includes flu as well as other respiratory illness. So there is some additional screening going on. But of course, you're right, there is that big emphasis on Omicron.
No, what I heard the other day and today and what I read is it's mild. Yes, maybe a little bit more. But you just mentioned that hospitalization is really low. And they're overwhelmed. So how come we don't just test the symptomatic people that show up? Why do we have to go and chase the contacts? Why don't we just assume that they're going to turn up sometime? I understand if we're trying to prevent people from going to the respirator, so we're catching them early. But if they're staying in a hotel or staying at home, why should we even bother testing? At least for Omicron.
If I could also comment to that quickly, Dr. Corte, and thank you. I think this is a topic that's also come up in other affected areas who quickly, if we start testing everyone who has a runny nose or everyone who's been in contact, they're going to run out of tests, and there won't be enough tests for the people in the hospital. So it is important not to over-rely on the tests. This is a time, as we move this towards the community in the next couple of weeks, that folks are comfortable staying at home if you are ill, and only if you're very sick and you feel like you need to see a clinician, that's the time to come and get tested. So we're not quite there yet, I think, but that is where most communities end up pretty soon. We just looked at the school recommendations for the state of Hawaii, and they have dropped testing as part of their school. They're not testing children who are sick, and then after 5 days at home, they're not testing them. They're letting them just come back to school after 5 days, as long as they're feeling well. So I think that makes sense. It preserves those tests for the hospitals, and as we work towards these policies in the next couple of weeks, I think your statements are going to be really wise.
Just quickly too, in regards to the severity, just a reminder, and Dr. Brostrom mentioned this before, that it is still early for a lot of these Omicron surges, and including like Guam and those places where, fortunately, we're not seeing a steep rise in hospitalizations yet. But hospitalizations do tend to lag by about 2 weeks from the cases. So, we'll find out. But you're absolutely right, based on that severity and accessibility of tests. We may need to change to that. And again, one way to really push that severity level down and the hospitalization level down is to, for anyone who's not vaccinated, get vaccinated. if you're eligible for a booster, 5 months since you had your last shot or 2 months since you had your Johnson & Johnson, you know, go ahead and get boosted and help push that severity down.
Dr. Thane and Dr. B, I did have one question myself. What is the outlook on this current worldwide surge? We keep seeing that it might peak in the U.S. within a couple of weeks. It's probably peaked in South Africa and in Europe. What's the global outlook on this current surge?
Thanks, Minister Gafar. And we talked about this morning. I think only a fool would give you a guess for what's going to happen next. We've all been tricked up by this virus, and we will continue to be tricked up. But Omicron is expected to surge across the world quite quickly. I've seen estimates saying that by summer, they think even the most remote places will have surged with Omicron already. That might include some of our Pacific Island neighbors who have also not had any Omicron yet. So we know what those surges look like. They're intense, but they don't last very long. And that's what we would expect to happen here if indeed we are at the beginning of a surge. And what comes after that is hard to tell if there'll be another variant. And we can hope, but we also need to very much prepare and learn from our experience.
Minister, maybe you can take the time and explain again mitigation plan again. Then area Allah present to Senate.
Silang President. So, waigel tilung tungul set plan algida ku tirak karingil at time and namnamura phase 2. Ya umasin raigel Lomakadol was a non-pharmaceutical interventions, gigit in mitigative measures or preventive measures. Umasindring niya already kadamrura bekal sils. Gigit tokorarwa barriers sa stawang maobis ang aring mong il sils gigit mokot mandate sa gigit al mask indoors, mask gigit outdoor gatherings 20 or more people. So maraming gigit di mo karingiya nakamaldil maumangat ondi ber yung ladi del wala maklol ondi bel kakaros sporting events at suko mga outdoors in 20 or more people ako mas sila ongero nga talug tel mo reinstate the self physical distancing ra arokul basyo including ra outdoors sa ungin na tolas mo 3 feet of physical distancing sila ng eday sa igibya alla ka test kits at sugo mo ka smer, please sila ka mo mais. Unless ka man mo hidol smer, ura o guru. Sige ta tol ngitingin at time. Kulmug talo mo maklat kala sa tol mo mga tmok lagi preventive measures. Malval, mangroy der ka smer. Selmal mo last study ka madingil was ilang mungal lang buklo sa bukreng. Madakter sila balu. Makmadil mo talo ngitra makloreng makleng sir adra bulu adamam ilang overwhelmed esel kim pom ay gay til betokon negative and yakal health program kut maklaw ilang maktil mo tulon ngiter sa igit ak madingin sa tiagit sa time and dul ngidingi namo erurak betokam la chance kadam lamrus namo niya ka krus el krut kadam lakut mok la yigit physical barriers sa igaro kulstawang kada na mamdul physical distance kada na mamdul mask by the way seldo dulo sa mask please la kaldil amol tais game malubal din amol tangre mamu mask ko full low mask do ko dagay game mangare namo irura kal bato ka bladru le chance adi imol dirga kal chance tegi del dak magulingit telo sa boto ngilo message sa igid sugo makadamlar mo lang malbato ko ludiol de kadil gamam baluro giram la katakay ngisem la kut pukti den mertegi emlat chen sa igigil bato ko ladrul adi imol diga ka chen sa tegi del sebo pring mata makulingit ta sebol maklorungut tot trokok krigi dara rupa ebo da lelak leda kay ngisew di sa igit ko manusin
Dia malam sulang minister di awira dong simbra me kulangit waila ikidal tokoil blamdung amal maklaw tutlel. Aktyo langit me dapsate lela a Dr. Robert, ma Dr. Iano, ma Dr. Cuartey, boldu adilo sisul tokoin di ungil. Di kulangit me maltob darang ritri del toktang le sel siora Dr. Robert ratuta man lekla impact ringi. Le optoisel adra bulur bela sen soma merong sia toktang. E tirari rong sia Dr. Robert ratuta man newil medol ni tertil tedem bol dugamen tertil le sel gumes ringi elang e gidel adra bela rogu a patient. E we need them to tell the patient what to do in order to save ours. Mang megol ni tertil tedem bol dugamen tertil mar adra bulur bela rengs e tira il sob aklidelen gire de Lorenz certin me gulite Dr. Robert Tambabong el Dr. Iano el Dr. Cuartel bolsep el coagilo armut malakda dogora mangal mut el musimbal gire la tol gidanga al bangring el altain Senate Dr. Robert
Senate President Dr. Thane and Dr. B, thank you very much for coming back to the rescue. So, thank you. Sitting here and listening, and you know, I went to the talk show this morning to try to calm people down. But sitting here and listening to what's going on, I always like to simplify things. And I'm looking at the downside and the upside of things. And this is kind of what I gather. You know, the downside of things, you know, is still the same. Medical capacity is still marginal. Our manpower is still marginal. Our isolation sites are maybe overwhelmed. And test kits are in low supply. We got vaccines coming. So those are things, but those are things that we can actually address, which is fine. Now on the upside of things, I you know, feel good listening to what you're saying as we're into this outbreak. But what I gather here is, you know, on the upside, we have increased population that's vaccinated. That's a plus. We still need to tell everybody, those who are not vaccinated, especially the young, and all who need to be vaccinated, get vaccinated, because that should protect us. So that 98% is upside. Also, you mentioned that this thing goes down very quickly, and that's good. So that should lessen the fear of the population. Another thing is that the severity is much lower, which is good. So it should lessen the fear. But I think the biggest thing that we need to keep stressing and tell the people is nobody has died yet. We have done a lot of these things that, you know, EOC and the leadership and everybody is trying to do all these things to prevent that one death. And nobody has died. We are here now doing this. I think we're doing a lot of things right, especially, you know, the ministry. So we should give them credit for it. People are scared, but I think we need to do those basic things. You know, that we just talked about masking, washing hands, social distancing. Those are the basic things we do, and we did that from the beginning. It works, but I think the message is get vaccinated, those who have not. Makti, mo gigil ito nga brigade because I wanted them to hear. Di tawar bela, kung sa ko din mo, ating nga na bela, Senate President mo kamsaun. So lomesa, talmalela tuway, maplong yung lela tuway. Sel one kukumesingin lito tula, audior ma, talital nga niya lang, adir ko sisiw. Tuwara guru la dir, masong sarigit. Kagalaled, hospital, may capacity, adir ko sisiw, makasay. Mar, ano laudior, mata makasay. Adir ko masongos. May site sa quarantine, mga hotel, maruwim, direk lang masong sa tial recent search. Gitial lomesin mo direk lang masong sa test kits. Hindi ke, igel si Eden gida, uspe anges urtir, Asali the address mga tmok hindi ngil. Diyan ko kumes ko kungyolet tiagi dosa ngil lang menggira dum luar ada belum mau keluar diri dia akan matapta. Tiga kita masuk di dalam Omicron normal. Buyul hindi mereka dan medio jarak. Jangan salman bosmer, kasar mo hospital, kasar mo nyuing, yang mereka dan mungkin. Selman lung yon ngari bladri other below up to kita namrus. Mako to close se lang dono ni other below rogu tiga lorus pomorus. Yang sobat klik. Tiga ngal lorus, ngoto siga dule lemrus tirogui. Yeah, that's way. You know, our population is very small, so hopefully we can go through this very fast and then get it over with, like you said. Hindi, that's yung mal-flow to sell. Ila dumarus. Tigil di lorus, lorus and protector. Di protector lang, protector. Armigay renal, mga tigil mo tira. Sige da that's yung message gila dun mura si Saul.
Salane Senate President Rate Al. Gotlontig morar adrablur belaw Senator Baules akmu lagom atakla rangod altoy legal tod rang rirar adra public health. Seguidi gotlontig lagom atakla ratora social media mar adal masada taqol dakhlo ngi segidi amal imol longtik ongerung ndirga katal other belon langwa yobo emos mer ndirga ma yobo ovreor yak malul ngitrar bek other belon mo bol nga ayobo tir ma booster tir ya ongedei ak malulngit mo bodo mask rokui di kay gidi a untig mortir
Sula Presidente Talteal umdaswen dahil sa kalmamungay la yelblaldo Dr. Robert ma Dr. Yano dik tiol talak luase ngal al virus avec le del buil mo imel buil en chensa bilel ya bailo bayri lang amaliliw dahil sa logrado del bail mang umdasen sa del change ra approach del morgi huk mengi le luasen gel mal sumangania maral mei bilel ngobrado malugente del sumo ngobrado bebira gel gira del momru la gira del momru magote yerogul black uira internet ma yerogul tol black friends tigal salir mla me help yida se qal omicron amiral mera uriu ngel me got el virus la mornia telal times la chensa bilel meren gayiden ngel got el alay tabiler ngi rogul ma ul maknoger sel testing o se the tower other sera ngayid amle no okrebitar nga ra January 21 2020 nga ora Minister Rahel ora Chief of Staff ora Vice President lugar aranimong seguid el mer elang kumera sula la Minister Rahel ra yerogul bla rule bebila time ang amombrel sa kanang mortil ang aktel gibel matigil o mesetil moruriw rarbekla. So, apologize sigil say, hindi hold kami to higher standard and that's okay. Yak apologize sigil. Hindi kakaimol adal madra COVID. Yar adal na madra di hutsul se raw lisil to. In fact, el al week, ikadimil di raw Wednesday musandi. Maikarogul to ko agila del malmay e mail do bodo. Lengyagi del Dr. Robert, lengyagi del Dr. Yano, mga kabokser, yagir murtal murak munta. Metel berada, toko kulwa sa makimakarang. Hindi rogul tokoy, blak to bodo, melmutal elal tutaw. En sa yakal mer madamiu, libertiang, President ra Republic, o President ta Senate mas speaker. Ek mo kumilo asal ngani obrado tol kuk elis del yakal maral mele le rulbuil orso, en dia al tayil. Ngani al mutal obrado del momgadar other velo. Dinga ko lingit lo asay lagal tayil ya muul edom dasalo asay dia al mutal maral me. El lutal maral me ko lingit lo asay Ministry of Health about proactive and rural research 1 week before abol obrado atoy emergo hido boto mo sambor raw. Tayil el experience ada kalungil experience minister. Ngirel ngari adan mungoy ay kal information e predict lo say kadamral mong mga next tol blok mo gertirang iliwi lo say ngari a rumors ra Delta Cron rumors. So hindi ako nilo sa general rumors, and then there are rumors out there. I'm sure they can tell us about it. Makto ay sila sa tell adi ang last. Edi adi tayo del COVID. A prediction na sa ngayon mutal baby da outbreak el maral may. Malo maral may. Ang la Ministry of Health mo ready. May gal capacity do rum. Hindi to kol marablo lang kasi. Tiang maral may ang lakal ataw. Hindi kal salmal mo mring la daw. Sedel lengalak keringi edo mesel wase sel kuk maral maing ngobrao de su ngobrao e bod alingi sel barao magulingi tel wase su maral smera ngliu magawas me e labora school malbe labo moulor mal labo trar be birara including ra mamel toktam including ra rogula ya ongerung magulingi tel wase bomo umas Sir Akmer El Alsis, I'm sorry not to sit by you, not because you have bad smell. It's because you're wearing the green tux, so that's why I sat over here. Because I think we need to send a message to the public. Mara Blue, el wasayel dologoy agire the practice. Sa ongerung. Ya ongere agil dologoy tigel turul toktang. Please have a vaccination. It's not about your right. Hindi ka right raw versus a right nga. Gire ra welfare gire rogoy. Malsugum ka malmisi all the same say nga ngani writer nga yes mara ngani writer ka tial to al your right your safety or other velo magulingit lo aseme eda bodo olay gigi eda ngarcel beredel leng talbori obra del maralmei e kada momol nin de hat taygi sulo
Kumesing malmlamu kora ulgege ma berkreka dua president agil bladu tinggal dedel toktang tinggal ada CDC ma ministry rahel ang yang namo blatak mura ada media ngomama ada olvira rulau lo sing di voltiga gida mo du igid la dosa da giret agid rakta ngir kami adra blu ngir reklam ngir kami lonter ngir ngar olbira lulau lo seme de berem di tigel export tam sauderngi madak teloran meke grey ese bedel kain seu engalak kertial egel lorgo daktor kuartim tigal toktang dengalak kertian dike grel atau jak dia de bobgik kuntera arada egal state ma delegates Emrenga sule me sule tigal la CDC minister tigal toktang el me el líder guide la discussion tira goten mudur comme cela
sulang speaker selbel demonstrating speaker ada kal tetela do mask adan diwi Hindi kadamral kotro ulang sakal ding util tal maral mara suli rogul toktang Dr. B, Dr. Hancock, and Dr. Yano, Dr. Roberts, Dr. Cuarte. I count it as a blessing that Palau has this talent and you here to help us through this time. So thank you and kumral musulang. Kumral di mga sula Dios, mga suliw, mga sula rebek other belaw. Kita menot mag dimlak ori mereka melayu borgit. Tolmol mersegi del kaltareng itu uru rasel ngar alet letial luguru letial sebab kelak langar kita ada kali ngar alet la ministry la health ngar alet rokui. Kalau di mukmigi kita mal dio litra abu tu ma bertigereng. Kado mask el kado bertigarung tu tamata adar bela. Amal misulang makot lurior.